Hi everyone, it's Dr. Nemechek. You're probably wondering what I've got here. This is actually called a Stereoscope. It's over 100 years old, and this is a device that people would take these cards that have dual images on them and put them in here, and you could actually see things in a new perspective, in 3D actually. And there's stories and all sorts of things you could have with that. And this is a gift to me recently for my birthday from a wonderful friend of mine. And it just struck me that I wish we had a stereoscope for coronavirus to know and figure out what to do. We're literally in the classic of uncharted waters. And medically, even for an old HIV specialist like me, I went through some of this in the 80s. Still has very, very unique, uncertain features that we're having to wait and play out. One of the things I just wanted to talk to you about is what's happening with the kids. I've noticed fairly consistently in the last 2 months doing follow-ups by Skype with our parents is that, the majority of the children are really struggling with this. And it's not a temporary thing. So far, the kids are having a prolonged, either frank worsening of behaviors, new behaviors, stressful reactions, more stimming, things of that sort, more aggression, or the pace of progress that we've had with their regimens has kind of come to a halt. Now, I've wondered about this. If this was like just a purely emotional concussion, a one-time event, that what happens is you'll have some negative neurological kind of ramifications of that, but within a few weeks you start to see things come out of that and recover. And we aren't really seeing that with the kids right now. And I think it's because this is a long, drawn-out process. The kids, many of them were starting when we had the stay-at-home orders in March. There's this abrupt change in their world. The children have a hard enough time understanding and decoding what their world is, and that rhythm to their life, going here, seeing that, seeing this teacher, this therapist, coming home, all of that has been turned upside down, and I think is very, very threatening to the kids. In addition, these kids, because of their inability to kind of, expressively communicate with us, I think they have these very fine-tuned sense and antennae for the stress of the household, and that mom's home, dad's home, brothers and sisters are all home, and that crucible that's going on there that we're all wrestling with is causing a lot of distress in the kids. And I don't, the parents are doing the best they can, and I don't really have a clear answer, but I just want you to know that's what if you're experiencing things like this with your children, this is what I'm seeing across many, many families, a couple hundred so far that I've talked to. There's some positives about this, though. Many of the parents have said they've spent a lot of now contact time without the therapists. They're doing a lot of the work on their own, and the parents have learned a lot. I've had a lot of parents say, we've been able to push harder and get more gains and have more positive time with their children, and that's been a very nice thing. But overall, I don't see the kids, I haven't yet see the kids kind of do worse and then come out of it yet. So we're still in this prolonged phase, and personally I'm wondering, when will the new normal develop such that the negative stresses abate and the children can do better? I haven't seen that yet. It may be happening here or there, but it's a pretty drawn out thing. Now with this, I don't recommend changing the protocol at all. I don't recommend more vagal stimulation or change to the olive oil or any of that, because I think this is an external factor. This is like maybe a mini concussion every day. And the protocol is not going to prevent that. The protocol is just going to help you heal. It doesn't make you, my protocol doesn't prevent you from getting a concussion if you fall and hit your head on the concrete, but it just helps you recover. So until we get out of this process of this continual stress, I'm not anticipating a whole lot of gains. All right. In terms of our office, we had not seen anybody in the office for about 3 months. We started this Monday. We've made considerable changes. The patients now, for those of you who have been here, you come in now. The receptionist Kim, she's encased in a big plexiglass wall around her. I jokingly call it the cone of silence, which goes back to an old TV show called Get Smart back in the 60s, for those of you who are old enough, or maybe it's on Hulu now, I don't know. But so Kim's there. The patients everybody who's wearing masks, patients come in. The patients have their own space now where they can take their masks off and be more comfortable. And I'm actually communicating to them through a glass wall. And so, strange, but we can still have our masks off, start talking. They can see the screen and we can do our interaction. It's just we have a barrier between us. And also the room that the patients are in, we have a special ultraviolet filtration system that ultraviolet light can actually kill bacteria and viruses. It's used in hospitals. So we have a system that will keep the air in that room clean. And obviously between patients, we clean down the room and wipe down the office and all that kind of stuff. Arizona has now become popular around the world. We're one of the great United States hotspots. And so we'll have to see what happens. If things keep spinning out of control here, we may, postpone more in-office visits for a while. I don't want people traveling if it's unsafe, and so forth. But we're just kind of deciding on week by week how we're going to do, and how we're going to run the office. But the traditional follow-ups are still in place, and by Skype and phone and so forth. So just to recap, the kids are all struggling. If your child's having a hard time, don't freak out. Don't change the protocol. Don't go add some other supplement. This is not an internal thing. This is an external thing. Okay? We can't do anything until we can get to some new normal and our stress lowers. And, if we had a device like this that could help me see things a little differently, I might be able to tell you when that is, but we don't. So just hang in there, do your best, and we'll try to stay in touch with everybody. Now, this is Dr. Nemechek, and I want to give you wishes from Gene and Kim as well. We all hope you're doing well. Stay safe and wear a mask whenever you can. Bye.